Excellent versus terrible nursing interviews. What is it like? What you should and shouldn't say during your interviews, and how to really conduct yourself when going to your interviews. That's what I'm going to be explaining, so keep watching. Hey lovely people, it's your girl Nurse Diaries and welcome back to another video. If you are new to this channel, welcome. I am Nurse Diaries. I speak about everything to do with nursing, everything to do with women's health, and I show you guys what it is to be a nurse as well. So I like to show you guys lifestyle videos. I like to keep you guys updated with what I do on my days off as well, just like a safe space for nurses and for people who want to know more about women's health to really relate to as well. So in this video, we're going to be speaking about nursing interviews and my advice for new grad nurses. So if you haven't already, make sure you subscribe to my YouTube channel and let's get started. So first of all, let's talk about nursing interviews. Sometimes they can be so scary, like going into an interview, meeting new people for the first time, and knowing that you have the responsibility and the pressure of presenting yourself in an amazing manner so that these individuals can actually like you and can hire you. It is a challenge, guys. I always feel nervous when I go to my interviews, but I think I've developed ways in which I keep myself calm and I'm able to actually be my true self and really present that to the person that's trying to employ me. So this is my advice to you. I think first of all, just think to yourself, they need you and you need them. It's a two-way process. And the reason why I'm saying this is because I think sometimes we just forget of the aspect that they have put their job out because they're looking for somebody, and we just think of the fact that you need a job, etc. So don't forget that they need you as well. So literally, if you do well and if you stay calm and you're your true self, you should be okay. Another thing I'd say is really listen when they're asking you questions. I think it's very easy to just like not actually tune in and just to speak and not actually answer questions, and that's what we'd call a bad nursing interview. If someone's asking you a question and you've literally just gone off topic, spoken about something completely different and not actually answered the question. With these nursing interviews, everything is like a point score. So if you've answered the question appropriately and provided them with a lot of detail, then they can tick you off, ensuring that you've actually met that point. But when you don't and you just go on a tangent and you don't actually answer the question, then it's quite hard for you to actually meet the point required for you to actually pass the interview. So that's one thing I would definitely suggest, to listen to the question. If you don't understand it, don't feel ashamed to ask, oh, is it possible if you can repeat the question, please? And the reason why I'm saying this is because it's better for you to answer it appropriately than for you to just speak about absolutely nothing, everything and nothing at the same time. Do you know what I mean? So that is something that I think is extremely important. I think another thing that makes a terrible interview is lack of eye communication. I think it's important to ensure that you're looking at your employer, like I'm looking at you guys whilst I'm speaking to you. I think it's very important because it just kind of helps bring a connection to the person that you're talking to and shows that you're actually very serious about what you're talking about as well. And guys, presentation, in my opinion, is always key. It doesn't matter what job you are going to. I think it's really important to look the part. So that means ensuring that you actually are wearing something appropriate. It's an interview at the end of the day. I feel like sometimes as healthcare professionals, we just turn up to our interview in like what, jeans and a crop top. But no, an interview is an interview. That's how I've always treated it. So look professional, look nice, and sometimes it does give you not extra points, but it just shows that you're serious about what you're doing, which is really important as well. Another advice I would say is when they ask you, do you have any questions? Guys, you should know by now, it is a trick question, and if you don't, I'm letting you know now, it is a trick question. They want you to ask a question. So if they say, do you have any questions for us? Ask, even if it's something very simple like, Do you have any training programs or any study days, etc.? It's important to ask, and it shows that you actually do care about the job, you actually do want the job, and you actually want to know more information as well. So that's the whole reason why they ask you that, is to trick you. Another question they tend to ask is, what would you do within... they give like scenario questions, and with the scenario questions, it's okay to listen carefully. Ask a question, what is the one thing that you struggle with? I think that's a question that we all sit there and reflect on, because you think to yourself, like, what do I struggle with? Sometimes it's hard to criticize yourself, but think of something. For example, if it's delegation, you can say, sometimes I want to, complete all tasks on my own. I understand that I need to delegate tasks to others, and this is something that I will continue to learn on, something that I will continue to expand on, and this role will actually permit me to do that. Do you see what I did there? I spoke about the problem, I spoke about the fact that I am willing to learn, I'm willing to change, adapt, and within the role that they are looking for, I will be able to overcome that issue, if that makes sense. So I think it's important to do something like that. And one more thing when it comes to nursing interviews, I would say, is, it seems very obvious, but most of the time it's not. Make sure you read and know what you're going to. Like, a lot of people just, maybe they have applied for multiple jobs and they don't actually read what they're going for, and so when they get to the interview and they ask questions about that specific role, they don't know anything. So make sure you read what it is that you're going into. Do a little bit of research on the trust, whether it's a NHS trust, or if it's a private trust, or even if it's a, I don't know, whatever it is, just do research on what the role entails. Do research on the place in which you're going to work at. It's really important for yourself and for the employer to know that you actually have tried. Second part of this video, I'm going to be speaking to you guys about new grad advice. So I've got 3 advices for new grad nurses that I'm going to be giving you guys. So my first advice for new grad nurses is to take it easy. I know that being a new grad nurse can be extremely difficult. We tend to put a lot of pressure on ourselves, and sometimes you just need to be like a sponge and soak up all the information. So what do I mean by that? I mean, literally learn from everybody around you, and I promise you it will get easier. Ask questions, ask and ask and ask. It doesn't matter if you're 1 month in, 4 months in, 6 months in, just be asking questions. It's so important, because you are going to learn from the questions that you have asked. So that is another thing I would say. Soak up all the information. Literally be a sponge, guys. Be a sponge. Another thing I'd say for new grad nurses is work on a routine that suits you. If you think that, okay, in the morning doing all your assessments and skin bundles, etc. works for you, you do that. If you think it works for you later on, you do that. Do whatever suits you, and you will find your own pattern. You don't have to follow somebody else's pattern. Do your own stuff and you will figure it out yourself. When it comes to time management, when it comes to patterns as well. But it's not a bad thing asking somebody for advice as well in terms of their time management. If that's what you need to help you, then you go and ask your colleague, like, okay, how do you usually start your day? And if you want to try and implement that for yourself, then that's fine as well. Another thing I say for new grad nurses is, even though you're in your new environment, doesn't mean you can't stop learning. I think sometimes it's good to actually still be doing research on your days off or time off or whenever you can, on what you're actually looking at. Like, what are your patients really coming in with? Do you understand everything? Do you need to do a little bit of research to have a better understanding of what you are actually seeing on a day-to-day basis? I think that's really important. I think that's something that I never did initially, but now I do try and do a bit of research, and it's actually giving me a better insight into what I'm seeing, having a better understanding of things, having a better understanding of how to look after these individuals, and it's really important as well. But yeah, guys, I'm gonna keep this video short and sweet, and I will see you guys next week for another video. Make sure you like, comment and subscribe to this YouTube channel, share with friends, and see you next time. Bye guys.